Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is what you need to know about facet injections. The facet joints are small, thumbnail-sized joints that are on either side of the spinal joints at every level from the neck all the way down to the sacrum. So you see a little thumbnail-sized joint, right, left, right, up and down, okay? These joints do have cartilage just like the hip or the knee, and together they combine to allow for an incredible range of motion of our spines. The facet joints are prone to arthritis, like I mentioned, just like other cartilage joints. Even though they are small, they can create an incredible amount of pain. Typically, it leads to pain in the vicinity of the joint. Often patients have several arthritic joints at one time. So here you see kind of a ratty arthritic joint with spurs and overgrowth of bone. You also see another one here. And typically, patients will have several levels. Okay, they can overgrow so much that they start to pinch on nerve roots as they try and get out from the spine. So here's what we look like from the, sort of an oblique angle. Okay, arthritic joint here with overgrowth of bone. Here as well. These actually look pretty good up here and down here. Okay, as mentioned, when the bone overgrows due to arthritis, it can actually start to pinch on nerve roots as they try to get out. That's called spinal stenosis. All right, why are facet joint injections performed? There really isn't a great answer as far as a facet joint replacement. We don't have a great arthroplasty like we do for the knee or the hip. So the non-operative options for facet joint arthritis include such things as a facet joint injection. The needle goes right into the joint. The pain doctor will inject numbing medicine and lidocaine. So basically, just like knee joint injection or hip joint injection that responds well to steroid and numbing medicine, so does a facet joint. How is the injection performed? Well, it's an outpatient procedure. It only takes about 10 to 20 minutes. Modern pain doctors do use imaging guidance, such as fluoroscopy, which is real-time x-ray, or they can use ultrasound guidance too. Usually you don't need IV sedation. You're not putting a needle around the spinal cord. It's really just going into the joint. Okay, the pain doctor will put the needle in, usually inject some dye to make sure they're actually in the joint, and then the steroid and numbing medicine is injected. They can actually do several levels at one time if necessary, or bilateral. You can repeat the procedure every few months just like you would a steroid injection in other areas of the body. How well do they work? 82% of patients receive pain relief over 50%, and significant functional improvement was seen also in almost 80%, and that's with or without steroid medication. The average duration of pain relief equals 3.5 months, 15 weeks, and the same results were also seen in a large 2007 study, so 2007 was repeated in 2008. So it's an excellent non-operative procedure for achieving neck or back pain relief due to spinal arthritis. Well, what happens if the pain comes back? Well, there are 3 treatment options if the pain returns. One is simply repeat the facet injection. One is to perform a medial branch block. These are the little medial branch nerve endings that supply sensation to the facet joints. Okay, putting a block, an injection around the joint, can stop the transmission of pain signals from these nerve endings. That's a medial branch block. Okay, the second option is to move on to a radiofrequency ablation, which is where a catheter goes exactly where a medial branch block would go, but it transmits heat and thermal energy and deadens those nerve endings. That can provide pain relief for 6 to 18 months. If you just inject steroid and numbing medicine for medial branch block, average pain relief is 3 months. Still very good. Are there risks with facet injections? The answer is yes, but very little. There's a slight risk of infection, bleeding, allergic reaction. The needle does not go into the epidural space, so there's a negligible risk of nerve root injury. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurance plans and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at newjerseypainnetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.